something bad that happened recently, or you like bothered by something that happened recently?
Yeah.
How often are you bothered by several, half, every day?
Every day.
Alright. Thinking or dreaming about something terrible that happened to you in the past, like your house was destroyed, an accident, assault, you know.
Every day.
I'm assuming with the accident and your sister.
Yeah.
Alright. In the last year, have you been hit, slapped, kicked, or otherwise physically hurt by someone, or has anyone forced you to have an unwanted sexual act?
No.
No. So you did tell me a little about what's been happening in your life recently. But what's the most stressful thing in your life right now?
Just coping
Coping.
every day. It's hard to go through these anxiety attacks, and it's hard to just live life.
I can imagine after what you've been through. It must be really hard. So, I know it must be difficult. But are you taking any medicine for anxiety, depression, or stress?
No.
Alright, so I'm just going to ask you a question about your menstruation, pregnancy, and childbirth. So which best describes your menstrual periods? The periods are unchanged, no periods because pregnant, or, well, you said you have no kids. Periods have become irregular or changed in frequency, duration, or amount. No periods for at least a year, or having periods because taking hormone replacement like estrogen therapy or oral contraceptive.
I'd say none of those things.
None of them.
Yeah.
Have you been having periods?
Yeah.
Do you still have periods? Are they usually the same? Are they regular, irregular?
I would say like regular.
Irregular. So, okay. During the week before your period starts, do you have like a serious problem with your mood, like depression, anxiety, irritable, or like anger?
Well, I do feel a little bit more down when I have my period.
You do. Do you notice that they go away once your period is over, or does it stay?
It does stay.
It does stay.
Yeah, because I get into this big funk.
So it doesn't help at all. Okay. Let's pause for a second. What time are we at?
36.
Oh, we're almost done. I thought it was a lot more. Okay, so which of the following statements most accurately characterizes you? Alright, so I'm going to read this a bit slowly. We're going to think about what you think most likely characterizes you. Alright, so as far as I'm talking in your pronoun. So, as far as I'm concerned, I don't have any problems that I need to change. As I'm aware of some problems and I'm considering beginning to work on them. I have worked on problems unsuccessfully but intend to continue trying. I am currently taking steps to overcome the problems that have been bothering me. I have already overcome some problems and want help now to avoid backsliding.
I know I do have problems, and I do want some help in trying to manage these problems.
So is this good, the one you're most likely to go for? I am aware of some problems and am considering beginning to work on them?
Yeah.
Okay. Alright, so that concludes the end of the questionnaire. So that kind of gave me like a general overview of how you've been feeling in the last basically the last month. it seems like the car accident that you had and the accident that your sister had has really really shaped your life a bit. Not so much in a positive way, but more so in a negative way. Can you remind me again how long ago it's been since the accident?
It's been like 8 months.
8 months, so not that long, so it's fairly recent. So I can understand why you have all these difficulties and problems. Alright, so the biggest problems is that having the accident has brought anxiety in your life, and you've been struggling with having anxiety attacks and panic attacks, and you want to learn how to cope with that, how to deal with those attacks that you get when you're thinking about, so you think about that accident that you had a lot, and you think about your sister a lot. So want to see if we can try to kind of shape your thoughts when those negative thoughts and bad memories do come to mind, and help prevent you from having an anxiety attack. It seems like it has, the anxiety attacks has made you feel like hopeless, and you don't have much pleasure in doing things and having fun, and it has messed with your sleeping schedule. It has messed with your eating, so you don't eat as much, and concentration a little bit. It also seems that the anxiety attack itself is like scary to the point where like you feel like you might actually die, because it's that frightening, and like the physical effects that that's having on you seems a bit concerning. And it seems like recently it has been making you feel a bit more nervous and on edge and anxious. We did talk about like being restless and pacing, and having like some muscle tension, and it seems like the eating is not as much, it's more so anxiety and like more psychological based. Alcohol is a little concerning to me, just a bit, just because you are still recovering from that surgery and taking medication, and I'm just concerned about the combination that you have with alcohol and medication. So the alcohol is a little concerning. The fact that you are mixing alcohol and medication, even though doctors has advised you not to do so, and you are feeling those side effects, yet you're still continuing to have those drinks because it makes you feel better, you feel like you have to, and it's interfering with your work life, causing you to be late for work, so that's something that we want to try to change, and a habit that I don't want you to get into. And it seems like it is just interfering with your life in general, interfering with you getting along with other people, and your performance at work, and taking care of things at home. Good thing is you're not really concerned about your looks, but you are very concerned about your health, which I am too, if I'm going to be honest. But it looks like the top things that we have to take a look at is the anxiety and the alcohol, and the panic attacks, and being able to learn how to deal with that. So I am going to talk to a therapist to see if we can come up with, a time for you to come in and talk to her. I'm gonna refer you to one that works best with what you've been dealing with, so you can get the best care possible. Because I want you to be able to drive that car with no anxiety, no problem, be able to not have to rely on alcohol so much. I don't want it to interfere with work and being late and having trouble talking to people, and I don't want you to feel down and hopeless. And have to go through those attacks and all those physical problems. So I'm gonna talk to some healthcare professionals and see what we can do to fix all those problems I just talked about. So So I'm gonna give you a call, roughly about a week or so, if we can schedule something if you're willing to do that.
Okay, yeah, I'll be definitely willing. I do want to get better.
Okay, and I really do want you to get better as well, because that's pretty scary what you've been going through, and I know it's been tough. So I'm gonna give them a call, and I'll definitely get back to you so we can schedule something, okay?
Okay.
I do appreciate you taking